Hi guys, karibu sana to Diabetesdocke channel. If you're new here, we talk about things to do with diabetes and also the newest and latest things that are up in diabetes care and also just general wellness and obesity care. So with me today is Micah. Micah, please introduce yourself.
Hi everyone, my name is Micah. I am a clinical nutritionist practicing in the country, and also I manage a very interesting program,
which we are going to talk about just now. So before we get to talk about the program, I want to say that the management of weight is extremely important in managing pre-diabetes, diabetes, hypertension, and most of the chronic illnesses, even kidney disease. Weight control is absolutely important. And that's why even in the newest guidelines in diabetes care, weight management is one of the core principles of treatment. And so that's why we have decided at Diabetes Care that we want to give our clients all the options for weight management. Because yes, we can talk about lifestyle changes, and lifestyle is key, guys. Like diet and exercise is a must. But then sometimes there can be some things that we do to kickstart the process or accelerate the process of weight loss. And that's why we are talking about this program today, known as the allurion program. So Micah has joined me today. He's a clinical nutritionist, and he will help us understand what exactly this program is and how it can help benefit you. So over to you, Micah. Explain to us exactly what this is.
So the allurion program is a one-of-a-kind approach to the weight issue in the world. It gives each person their own personalized journey, so that when they walk it, by the end of the day, they understand themselves better, and also they have the tools to support their weight further. So it involves the use of a medical device called a gastric ballon, which is scientifically and specifically prepared to help with the occupying some space in the stomach. Since when we're talking about weight loss, we have to look at caloric deficit.
Yes.
So the device helps to achieve physical caloric deficit within 24 hours, and then it is modified with some follow-up by a team which comprises of a physician and a nutritionist who guide you and keep watch over you, making sure that your parameters are in check, that all the results you get are within the limits that are safe for you. And they work with you for 6 months until the end of the program.
And I like that. You know why? Because I personally have heard of cases where people go maybe for surgeries or even for procedures, but they don't have that person who is following through for them. You can go for the procedure, you're done, you go, and then what about the rest? What about if, for example, you have diabetes? Who is taking care of your sugars? How are they monitoring them? And that's why I love this program, because it brings the physician, exercise, nutrition together, so that even when the balloon is placed, the patient still has a holistic care around him or her. Isn't that right?
Yeah, that's true.
Yes. Now, please explain to us how this works.
So, when you come to the clinic, you will be done some assessment, which will include a bit of medical history, just to assess and make sure you are suitable for the program. And after that background, you will be taken through a preparation phase of about 1 to 2 weeks, using some anti-acidity medication, all preparing for the placement. You'll also be given some anti-nausea medication, which will assist with the day of placement that will be booked during the consultation. Okay. So on the day of the placement, you will be required to have fasted for about 8 to 12 hours, just to keep your stomach clean. But you are allowed to take clear fluids up to 2 hours before the process. Then when you walk in, definitely the doctor will take you through the process again and prepare you, and make sure you are well versed with the requirements. You're well versed with everything that will be done within the room. Then you'll be taken to the procedure room, which will be mostly in an X-ray center, because the process requires the services of an X-ray. Okay, so the X-ray is basically to just make sure that because this one has a wire that can be seen through an X-ray, so just to make sure that it's in the right space. Oops.
So just to make sure that it is in the right space, it's not gone too far or it's not before the stomach. So let's say the patient has come in and now you're ready to start the procedure. How does it go?
So you will be ushered to a seat.
Yeah.
Your team will be surrounding you. You will definitely be adorning a gown, just for the safety of yourself.
Yeah.
Especially should there be any gag reflex that will involve a bit of vomiting.
Yeah.
Then the doctor will open the fresh pack and show you the vacuum sealed capsule that you will be ingesting, and then they will either assist you by placing it at the back of your mouth or hand it to you to do it yourself. You will only be given 3 trials to try and swallow. On the 3rd trial, if you're not able to swallow, you will be assisted by the physician. But if you are able to swallow, then we proceed to the next step of the X-ray.
Yeah.
In the process of swallowing, you'll be given 2 types of water. The first water is the normal mineral water. That one is just to wet your lips and wet your mouth so that the capsule doesn't stick inside, and also to keep your throat a bit lubricated so that it slides down with the action of peristalsis. And then as you are advancing the capsule into you towards the stomach, the physician will keep checking these 3 marks. The first mark shows past the uvula. Yeah. The second one shows we are close to the sphincter, the opening of the stomach. The third one shows we have passed the sphincter and we are inside the stomach.
Okay. So it means there's no danger of us going beyond the stomach.
No, we are always there observing the full process.
Oh, that's great. So you want to tell me that this, of course I know, I'm just asking because I know most of our viewers are wondering, how does this become this?
So once the capsule gets to the stomach and we do our first X-ray to confirm its position, whatever is covering this is actually a cellulose material, equivalent to what you'll find on your fruits.
Okay.
So it's cellulose.
Yeah.
It dissolves when exposed to the gastric contents of
so
the
it
stomach.
is digested by the stomach.
Yeah, releasing now the balloon. This is the balloon. So once we have taken our X-ray and confirmed that it is in the correct position, then we proceed to expand it using 550 cc's of sterile water prepared from the company. Yeah. So the expansion process takes about 7 minutes, and then you now have a fully inflated balloon in you. Yeah. Then we proceed to the next step. We do a second X-ray to confirm
placement.
The balloon is sitting in the correct position. The balloon is also radioactive. Yes. It has a radioactive marker, and also this white spot here, if you can see it. Yes. Those are the ones we use to know the position. Plus, when you are taking the second water, the carbonated water, the gas creates a cavity-like effect in the stomach that enhances the image. Okay. Yeah. So you're able to tell exactly where it is. Yes. Then now once it is there, so you're saying this procedure will take a maximum of how many minutes? So from start to finish, the longest I've seen is 30. Wow. No anesthesia, no surgery, you walk in, walk out. You can drive yourself back home. Actually, that's the whole process. That's the whole process of the program. We want to make it as seamless as possible with as minimal discomfort as necessary, so that you can walk into the clinic, get your balloon position, and go home and continue with your day. Isn't that fantastic, guys? I think it's worth it. So now, once it is in the stomach, for how long does it stay in? Is it a lifelong thing? So the balloon stays in situ for about 16 weeks. Okay. After 16 weeks, there's a self-release valve. This that we can use the self-healing sutures we use on wounds. Yes. Yes. The stitches we use on wounds. The one which dissolve into the body. Yeah. Yes. So we can use that we can equate that to whatever we use here. So under constant exposure to a constant environment, the lining of this valve deteriorates at specific rate, so that by the 16th week it starts releasing.
Okay.
So instead of releasing spontaneously, it releases gradually, spewing out the water into the stomach
slowly,
so that the balloon deflates gradually, rather than the one that happens spontaneously.
I think that you've answered someone's question. I'm sure someone thought that there's going to be an explosion of water in the stomach.
Yeah.
So it's a gradual thing, and after 4 months, it's probably getting out of the system.
Yes.
And then what measures do you do to make sure that then the person who has ingested does not go back to how they were before?
So the 6-month program is tailored to ensure change of habit.
Yes.
So we're targeting behavioral change.
Yes.
And we are educating you from the point of your kitchen rather than from the point of our books. So instead of you being introduced to our books, we are actually introducing our books to you and modifying from inside coming outwards.
I like that.
To create as little friction as possible in your lifestyle, because remember, whatever you consume has built you up to now.
Yeah.
It is what you're comfortable with, and it is what you're finding sustainable.
Yeah.
So if you are going to take up a journey to lose weight, you need to use the most sustainable thing around you, which is your meals.
Yes. And that is why this program is so successful, because it's not just about this, it's about the behavior. Obesity is about behavior. What do you eat? How often do you eat? What food choices do you make? And that is why it's very important to have someone who walks the journey with you and ensures that even when this thing releases its water, by that time you have already learned to adapt to a smaller stomach, and you've adapted to smaller meals, healthier meals, and you have now had a nutritionist walk the journey with you, and you have modified your behavior in a way that is sustainable. I like that. So that means that you are able to follow up with the patient for as many years as possible. It is not just about the program, right?
Yeah, because we encourage a healthy relationship between you and the clinic.
Yes.
So that when you start with us, we become part of your lifestyle.
Yes.
Also. Anytime you have a question, anytime you have anything, we are always there, available to answer you.
Yes.
Plus, with the process of making your meal plans from your kitchen, whereby the person knows everything in your fridge. When you wake up, you just say, I feel like having 1, 2, 3. They know whatever is already available. They won't say, no, go look for something that is not available. It's what is already in your kitchen that will make your meals.
Yes. So there's no point of going out there to buy very expensive, very out of touch foods. It is still the foods within our reach. We just modify how we are going to use these foods.
Yes.
Amazing. So guys, this is the Allurion program. And the reason why I think it's very important is because we need to think out of the box when it comes to weight loss, especially for me in diabetes care, because I have seen some of my patients do so well with lifestyle changes, and they have lost weight and reversed their diabetes purely on lifestyle changes. But I've also seen some of my patients struggle because weight loss is not that easy. And that's why there is a choice of helping the patient accelerate their weight loss program while changing the behavior pattern, so that we have a successful weight loss program, better control of blood sugar, better control of blood pressure, and a healthier patient in the end. And that is why Diabetesdocke Clinic is there for you. We have partnered with Micah and the Allurion program to bring this to you and be able to tailor it to you, even if you have comorbidities, even if you have diabetes, hypertension. We are able to walk this journey with you. So now, a common question, of course, is how much it is.
So depending on the individualistic approach, the cost varies from person to person. Because there's someone who will come and say, I'm not diabetic, I only want to lose weight. That definitely the cost will be different from someone who is diabetic with comorbidities and has to be taken through some very specific and sensitive steps.
Yes. Yeah. So that means that we will have to visit with the patient, with the person. They come to clinic, and then based on their comorbidities, we can now tell them that this program will cost this much for you. So it's an individualized approach. Is there any range? So
right now, the lowest price in the market, or the lowest price chargeable, is about 450,000 for the full pack. And remember, the program comes with some follow-up tools that you retain even afterwards.
Yes.
You get a smart scale and a smart tracker that helps us as a clinic, or helps you as a physician, remotely follow up your client and make sure they are on track with their
weight loss. So basically what we are saying is that the weight includes the nutritionist's reviews, the physician's reviews, and also the tools. That is a smartwatch, a smart digital scale, which transmits all the information to us so that we are able to follow you up from wherever you are. So you can literally do the program, get it fixed at Diabetesdocke, and fly to Italy. And we'll still be able to follow you up.
Exactly.
And I think that's amazing. So thank you so much, Micah. We'll continue working together. And I hope that this demystifies the whole program to you who's watching. And for those who really are interested in weight loss and you do not want a very invasive procedure, this is something that you should consider. Thank you very much. Bye-bye.